Hello, welcome to Holistically Speaking. I am your host, Morella DeVoe. Oops, we've got music again. Our mission at Holistically Speaking is to be the avenue through which the voices of holistic health reach you, our ever-expanding community, at the time you need it most. Today we are live. It is Sunday, July 28th, right? I think it's Sunday, July 28th, at 2 o'clock, and you can call us with your questions at 651-0589. Today we're talking about Lyme disease with local expert Sallie Mack. Everyone talks about you as the person to go to for Lyme disease, so we're thrilled to have you. And before we start talking to Sallie, I want to show you a couple of websites that you can go to look for Sallie and for resources. It's VermontHomeopathy.com. That's Sallie's website. And then VermontLymeSupportNetwork.org. It's also a website created by Sallie, and you can find their information on living with Lyme, resources, treatment, prevention, and more, and just getting a lot of support. And we'll show you these websites again at the end of the show. So Sallie, thank you so much for being with us.
Oh, thank you for inviting me to be here.
So as you describe yourself, you're a Limey.
I'm a Limey, not from England, but I'm a Limey, yes.
You're a Limey. So tell me, what came first? Did you realize you were a Limey and then you became an expert, or were you doing this and then you realized that you were kind of your own case study?
Well, my story basically is when I moved here from Alaska 20 years ago, I was a vibrantly healthy 35-year-old, and slowly over time I noticed I had pretty strange symptoms that I thought were maybe carpal tunnel because I'm a professional musician. I was a sailmaker. I've built a lot of houses. I've done a lot of things. I'm a small person. I thought the pain in my arm and neck and wrists were just overuse. And I also had symptoms such as flu-like symptoms in the middle of the summer, and that was odd. And I always thought it was maybe food poisoning. If I would go to Connecticut to my in-laws' house. And
so, how long did it take you from kind of having symptoms to knowing?
About 16 years.
16 years.
I had several. I went to my primary care physician regularly to ask what's this joint pain and what's the fatigue and the brain fog and why I just don't feel well. And I had many Western blot Lyme tests and the 2-tiered ELISA and Western blot tests, which are the standard tests that most medical community practitioners will administer. The test, unfortunately, is 30 years old, and it's not reactive enough looking at the types of antibodies and antigens that the Lyme bacterium would produce to show a positive test. So over the years, I had many, many tests, and those tests all came back negative. And so they said, sorry, you just don't have Lyme disease. We don't know what you have, but you don't have Lyme disease.
It's not Lyme.
Yes.
So how did you eventually realize that you did have it?
Well, what happens is that we all run around then to another doctor or get another test, or when we go to a rheumatologist, or this and that, because I have joint pain and I have brain fog and memory issues and things like this, and we don't know what's wrong, and so we see a lot of specialists. We end up costing the healthcare system a lot of money, and they run a lot of tests without any definitive information because the blood work looks good, you look fairly healthy. It's just very difficult to detect until you really look at the long clinical symptom list. And it can be easily diagnosed through symptoms clinically, as opposed to getting an inaccurate blood test. But if the physicians aren't familiar with the long list of physical symptoms, it's not going to pop up for them. So it is the great imitator. And this is the sad thing, is that it gets diagnosed as MS. And we found that even Parkinson's and ALS in these autopsies and postmortems, that it actually can be the Lyme bacterium that is in the brain that's causing these neurological symptoms.
Wow.
I mean, it's not 100% definitive, but there is a lot. And if the body is going through this bacterium for so many years, it can cause such irreparable damage.
So for you, it was pain, flu symptoms.
Flu-like symptoms out of the middle of nowhere, just vomiting, diarrhea, upset tummy, weight loss, fatigue, fevers, lots of night sweats. I was also of the menopausal age, so they all thought, oh, your night sweats are just that. But what comes along with the Lyme disease are co-infections.
Right.
The critters that infect us, the bacterium from the Lyme tick, is not just Lyme. It's a very, very complicated disease system now.
Yeah. So I do want to remind our viewers again that we're live right now talking with Sallie Mack, who's a homeopath and expert on Lyme, and you can call us with your questions at the number on your screen, 651-0589. So Sallie, I've also heard that there's a window of time between getting bit by a tick and getting tested for Lyme, where your probability of being tested positively or getting a positive result, an accurate result,
correct,
is higher.
That's correct. That true? Yes, that's true. It takes about 6 weeks, give or take a week or so, for the actual bacterium to be engaged enough so that the serology in the blood will actually show the sensitivity in these tests. So often people will have the test too early and it won't show, or if it goes way too long, it can be difficult to show up because of the spirochete, spiro meaning it spirals. Right. It is related to syphilis. It can go, once it's gone out of the bloodstream and it goes into the connective tissue and it burrows, it can burrow right through bone. It can burrow into all kinds of ligaments and so on. And so this is what creates a lot of this arthritis and this wandering joint pain. Because one day it'll be your shoulder and the next day it'll be your knee. A few days will be fine, you'll feel great, next day you'll feel fatigued, you can't sleep well, you have a lot of agitation. And then we can get into the neurologic Lyme. I mean, there's arthritic Lyme, that's the first stages of all this stuff, and then when it goes so late and so long into the system, gets into the central nervous system, and it does affect through the blood-brain barrier into the frontal lobes. It can affect the liver, the heart, most of our organs.
When it affects the nervous system, because you were saying that you actually had it in your frontal cortex,
frontal lobes, yes.
In your frontal lobe. So what does that manifest as?
Well, a huge amount of memory loss, inability to sentence structure. I would be driving down the road on the wrong side of the street. Wow. And not realize it until I realized it. You walk into a room and you're like, what did I come in here for? It is like that times 10. It's everything. It's memory loss. Then you can start getting tremors and muscle weakness, and the fatigue is really some of the worst part of it, and not sleeping well. And then you get into rage, depression. All of the Lymies laugh about our partners who have to put up with Lyme rage because they need to have support too to understand that we are so sick and it's affected so many parts of our bodies when it's gone for so long that the depression, you're not sleeping well, certain foods you can't eat. Right. Food often, it's just many things. So
is there, do you have in your resources, your websites, is there like a list of symptoms that you might look at and say, oh my gosh, I might
I've got them right here in front of me. And I would love to go through them. Everyone should know too that only a small percentage of the people, maybe 30% or less, will get what they call as an EM or a bullseye rash from the actual tick. Now you should also know that ticks, when in the spring, the nymphs are very, very tiny. They're the size of a poppy seed. So you often don't feel them crawling on you. They're so clever that they will hide in places that you will never see them. Your back, your hairline, behind your ears, under women's breasts, men's scrotums, armpits, places that you will not just see it and notice it. New discovery has also shown and found that the Lyme tick will administer a little bit of anesthesia as it's digging its mandibles into your skin, so you will not feel it biting. And this is the other trick of how it can survive and really get its parasite into you. Because in that anesthesia is also the glue of the mandibles that help it adhere to your skin so it won't fall off.
So before we get into the symptoms, since you're talking about the tick itself, you were showing us this great little sheet to identify ticks, and this is available at...
well, there are different places. The health department has them.
The health department has them to identify ticks, and it also talks about how to remove them. So can you tell us just briefly about how you remove a tick appropriately?
Sure. Sure. It's really important that, first of all, you don't put anything on it. You don't try to alcohol it or hydrogen peroxide or put Vaseline or anything. Absolutely do not want to put anything on the tick. You do not want to squeeze the tick. You do not want to squeeze the area around the skin because you will end up driving more of the bacterium in it. Now, I really believe in this. There's a lot of controversy around how to treat Lyme, when to treat it, do we treat it or not? How long has the tick been attached? There's, the CDC website says only treat if it's been attached with an EM, which is this Bullseye Rash, if it's been attached for 36 hours. I really feel if it's attached, if you're not able to just flick it off and it's been attached, you should go seek medical help and get on an antibiotic prophylactically because it may be a Lyme tick, it may not be a Lyme tick. You just don't want to take the chance.
Right. So,
so then the best way, if you don't have this wonderful tick twister, Otom tick twister, you can find at the local pet food warehouses and the vets and other places. It's a neat little tool, and it has a little slit in it, and what you want to do is come from behind, or tweezers. You don't want to come to the face of the tick, but come from behind it and try to really get underneath it and get into those mandibles and try to gently pull it out of the skin and back it out. There may be some of the mandibles still left in the skin, and they will eventually just come out.
So I've also heard that once you pull a tick off, that you should keep it, freeze it, or?
What I do is I tend to kill it, tape it to a card. I completely encase it in tape and mark on it the date that it bit me, and then you can take it and have it tested. If you have questions about it, it's good to just know or mark on your calendar that I removed a tick on this date, just so you know.
So would taking the prophylactic antibiotics interfere with any testing of Lyme?
It can. It sure can, yeah. It can knock it down enough so that you don't have the sensitivity, but it doesn't mean that whatever course of antibiotics you've been on, and again, this is very controversial. Some doctors treat with longer, low-dose types of antibiotics. Some treat with high-dose, shorter periods of time. My tendency is hit it pretty hard for a pretty long time. Because, again, and you try to see a Lyme literate doctor if possible, and someone who knows. Because if you're in a state further beyond the initial Lyme infection, given the wrong type of antibiotics, you can actually drive it into a deeper, harder, more difficult state to treat, which is known as cell wall or also cyst form. So it's really important that you just don't throw any antibiotic at it willy-nilly. Children under the age of 8 should not have doxycycline. Doxycycline is the #1 go-to antibiotic that we tend to give immediately right after a tick bite. That can be 200 milligrams for 3 days, 2 to 3 times a day. Some people believe doing it longer.
So everything that you're saying, what it's making me as a layperson think about, oh my gosh, if I get bit by a tick, well, obviously I'm going to remove it, I'm going to save it, but it sounds like I really want to talk to someone who knows what they are talking about with regards to Lyme, and not necessarily
your primary care physician
who may not have treated it or may not have been that well versed on it.
Exactly, and they often will go to their computer and they'll look up the guidelines at the CDC. And what I'm recommending is that they go to the International Lyme Association website, and they have much better guidelines.
It's almost like you want to go to a Lyme specialist.
Yes, you do. You do want to go to a Lyme literate doctor, of which there aren't that many. And they're going to be more, because once faced with, you see what your patients are living with and the way the medical community has not really looked at what's going on here, there's a lot to learn.
So you have a list. So do you want to read off the list?
I would love to, because this is very important.
So that we can...
You may or may not have the bullseye rash. There can be some inflammation around the bite itself, whether it looks like a bullseye. It could be a raised bump. It could be very sore. You could feel immediate pain generally too. I mean, just sharp shooting pains. Some people may not. The lymph glands in your body can start to swell. You can have a continual low-grade fever. You could also have a high-grade fever with chills and sweats. This is usually a bacterial co-infection. That's an indicator. General flu-like symptoms, a very frequent headache that comes and goes, a stiff neck, regular to moderate or muscle joint pain and joint pain, regular joint pain to moderate, or severe unremitting types of headaches. Bell's palsy, that's when this one side of the face collapses.
Okay.
If that's the case, it's 100% Lyme disease. I mean, I don't understand people who have Bell's palsy and their doctors say, I'm sorry, you're not testing positive for Lyme. It's pretty much a neurological fact of Lyme disease.
Okay.
Mental confusion or difficulty in thinking, disorientation, getting lost, that's very common. I would not know. I'd be on the wrong side of the road and I have no idea where I am.
Wow.
And I could be a mile from my home.
Yeah. And again, just in case anybody is joining us right now, we are talking about Lyme disease with Sallie Mack, who's the local expert on Lyme disease. She's a homeopath, and she's reading off a list of possible symptoms and indicators that someone might have Lyme. So please go ahead.
So there could be lightheadedness or woozy, mood swings, irritability, depression, disturbed sleep, fatigue, tiredness, poor stamina, vision that's blurry or with floaters or light sensitivity, feeling pressure in the eyes, stiffness in the joint or back, twitching of face or other muscles, neck creaks, cracks, stiffness and pain, tingling, numbness, burning or stabbing sensations and shooting pains, chest pains, heart palpitations, shortness of breath, chronic cough, buzzing or ringing in ears and sound sensitivity, motion sickness, vertigo and poor balance, sudden hearing loss, tremors, weight gain or weight loss, swollen glands, menstrual irregularities, irritable bladder or bladder dysfunction, upset stomach or abdominal pain.
Wow.
And that's the big picture, but there are other symptoms as well.
Quite a list. And so would you say that the typical person experiences a number of these symptoms, or?
It depends where you are in the stage of the game. Early onset of Lyme, you can have fatigue within a month of being bitten, or immediate, or 6 weeks. Wandering joint pain, you notice when these fronts come in that you're really stiff.
Oh, okay.
People will say to me, gosh, I just think I'm getting older, and I'm like, I don't think so.
Yeah.
I think I know the body in its ability to heal itself, and if you haven't had traumatic physical injuries, things should work for our entire life.
Isn't it something that there's almost like this accepted notion that the body just deteriorates, and so you're just getting old, and we could just actually listen to what the body is saying as, actually, I'm just trying to tell you something, that there's something going on.
It's a red flag. It's all it is. Every symptom, and certainly as a homeopath, every symptom in the body is just a red flag saying, pay attention, I'm out of balance. Something is off kilter.
Right. And so if someone does have Lyme, so you've told us about antibiotics and getting the right antibiotic for the right period of time. What else does someone need to do? Well,
let's preface that with, we don't really know that even at the onset or with an immediate dose or several doses or long-term doses of doxycycline or any antibiotic, is that 100% effective. We don't know. Most cases aren't ever totally cured, especially certainly early onset and healthy immune systems and a good lifestyle can keep a person very, very healthy. What typically happens is that you can be asymptomatic for a very long time, which I suspect I had symptoms but just thought they were other things.
Right.
Just tossed it off to overactive, too much of this, whatever. And it can easily go for a long time just with that sense of, something's not right, but it's not so bad, and it's bad today, but I feel okay tomorrow. Or so it's really touch and go on that feeling. Should I see a medical practitioner? There are herbal treatments.
Yeah.
Healing Lyme. This is one of my favorite go-to books.
Yeah.
Stephen Booner is an amazing herbalist, and he also wrote a brand new book that just came out this spring.
I'll hold this for you.
This is called Healing Lyme Disease Co-Infections. More for the practitioner. This has so much amazing information, but all about healing without antibiotics.
And so you mentioned nutrition and herbs. Are there any specific nutritional guidance or guidelines that you might give someone who's dealing with Lyme?
Well, yes. Again, like any situation when your body's fighting a bacteria, your immune system is struggling. The bacterium with this particular Lyme disease here is very crafty in knowing how to hide, knowing how to set up a biofilm, or what's also known as a cyst, a microfilm, or a biofilm or a microcyst, so the antibiotics can't actually penetrate it.
Okay.
So we've learned over time to use enzymes, serrapeptase or Baluchi, or certain things that will crack and open up, grapefruit seed extract, flagell, certain types of things will open up that biofilm that most bacteria have learned to make, whether it's Lyme or another type of bacteria, which what makes it so difficult to treat. For years we've been hitting it hard with antibiotics, but if you don't open up that biofilm, you can't really actively get in there and kill it off.
So you do that with supplemental enzymes?
Yes, yes. That's again why you need a Lyme literate doctor. In advanced stages of Lyme disease or chronic Lyme, you really need to have a Lyme literate doctor who knows which are the appropriate antibiotics for the types of symptoms that you have. Typically heavy metal testing will occur because many of us are heavy metal toxic. That's affecting our immune system. So anything, candida will often look at yeast and mold in the environment or in the body, try to knock that down, try to make sure that there's not a heavy metal count. All these
so
things
it's like all of these other things that are weakening your immune system, so your immune system is fighting all these other battles.
Along with being taken completely down by the Lyme and the co-infections that are now messing with your DNA and RNA.
Right.
So you're chronically incredibly ill, and then you start having neurologic symptoms, and again, we start going to all these doctors, and nobody really knows. I mean, I was diagnosed with chronic fatigue and fibromyalgia, and what is fibromyalgia? I have to ask. What is it? What's the etiology? Why would I suddenly just start having all this pain?
Right.
There has to be something that started this particular thing, and the amount of people that have been diagnosed with this nefarious constellation of symptoms need to absolutely have the best Lyme test available.
Right.
And that means spending out-of-pocket money. Right. Medicare will pay for the IGNX test. Some insurance companies will, most won't, and this is what's keeping people from really learning that they have Lyme disease and getting treatment, because they need to have the right test.
Right. So going back to what you were saying, people need to strengthen their immune system, so you're talking about enzymes and grapefruit seed extract.
That's to open up a biofilm.
To open up the biofilm.
But I mean, we typically recommend astragalus roots and things like this that will keep the immune system strong. I mean, you can use homeopathy for constitutional health as well.
Do you work with probiotics as well?
Absolutely. Diet is very important. You really want to stay away from all the sugars, carbohydrates, especially in advanced stages of Lyme. My diet is basically protein and greens.
And greens.
Protein and greens. I try not to eat. I crave carbohydrates, and that's the other thing. They've now found that the Lyme bug will set up a craving in your brain to feed it carbs. So carbohydrates, you really need to stay away from carbohydrates, and that would be any types of sugars. Alcohol, absolutely no alcohol. Most people that start having really strong, they never had it before, they could have a couple drinks and feel fine. If you're having really strong reaction to alcohol and you're having all these other symptoms, that's classic.
Right.
The liver is infected, the liver cannot process alcohol, you will feel really horrible. I try every now and then to have a little drink. I can't.
Wow.
In the first sip.
Your body can't process it at all.
The first sip I have, my body immediately just says, ooh, this is not.
So lots of greens, healthy protein.
A lot of healthy proteins.
Any fermented foods?
Lots of fermented foods. Any of the things, again, that are going to create health in the gut and keeping the immune system healthy. White refined sugars and flours are just very destructive to the immune system.
Right.
So if I have to eat a sugar, it's either maple syrup or honey. The carbs would be Ezekiel or sprouted breads, as opposed to just going for the heavy carbs. No refined oils. I do a lot of coconut oil and coconut milk.
Yay, more fans of coconut oil.
Yes, we live on it. In it, on it.
Did you say milk?
I don't do any dairy, very little, unless it's fermented. Kefir.
Oh, you said coconut milk.
Coconut milk.
Yes.
Yes.
Okay.
I don't. Yeah, I'm not a big proponent of regular dairy. I don't do any soy products. No. Stay way away from corn. All GMO foods you need to stay away from.
Right. Yeah, just in general.
Yes.
Sallie, do you ever become Lyme free?
You can knock the bacteria count way down, and all Lyme literate doctors will tell you that you'll always be in treatment. Because once, and I'll give you my little story too, is that I was very suspect that I did have Lyme, and I never had a test for a long time. And when I went back to school to become a homeopath, all the naturopathic physicians said, "You're classic."
Oh, we have a caller. We have
caller.
about 4 more minutes left, so.
Wow.
Hello, you are live on our Lyme show with Sallie Mack. Do you have a question?
Hi, yes. I was just wondering if you had any tips for any meditation techniques to help relax.
Yes, sure, absolutely. Great question. Relaxation, sleeping, resting, meditating, yoga, all those things were actually my Lyme literate doctor recommended that I do, because your nervous system, sympathetic, and all of your nervous system becomes incredibly hyped up when you have Lyme bacteria floating around in your system. This is the agitation that comes, the Lyme rage, along with the depression. So meditation, whether that's transcendental or any form of meditation, Vipassana, doing yoga, the things that I would use at home, particularly to help me to sleep in agitation, I like the sensation of where I pretend that I'm a candle melting on a table. That sensation just before you go down an elevator, that little up before that. When you love an animal, when you're giving unconditional love, the pet therapy, all of those things really bring down that agitated nervous system. Being in nature, communing with nature, calming the mind, thoughts, making sure there's no stress in your life. Every time, even to this moment, that I have stress, all my symptoms come right up.
Right. Wow, wonderful question. Thank you so much for calling.
Thanks.
That was a wonderful question. I hadn't even thought about that.
Yeah.
So you've shared with us issues with testing. You have to go to Lyme
Literate doctor.
You've told us about immune system boosting tools and food and removing ticks. You've covered so much. And I'm curious, are there any particular places to look for ticks on a pet's body? You've told us about our body. What about pets?
Yeah, well, they're same thing. Basically, the tick has to go to the animal's mouth to get a little saliva.
Okay.
And so it's typically around the head area.
Around head,
The head
mouth,
typically,
ears.
or the abdominal area where there's no fur.
Cool.
Dogs are susceptible.
So just before we wrap up, those are the 2 websites that you can go to get resources. That's Sallie's website, vermonthomeopathy.com, and vermontlyme-support-network.org is all kinds of information on living with Lyme, resources, treatment, and prevention, and more. Any final thoughts? We have about a minute.
Well, I think that if you have any questions or concerns about any of these symptoms, or any doctor that tells you that there's nothing wrong with you and you really know that there's something wrong with you, you need to you need to be your own health advocate. And that's what I had to do. I had to really pursue what was going on with me and get to the bottom of it. Get the right doctor, get the treatment. It's very difficult. Treatment is very hard.
Right.
My doctor said, cancel your life, and I basically had to cancel my life, and it worked.
Yeah.
And I'm now on Chinese herbs that are meant for keeping Lyme bacteria down. I do a lot of coenzyme Q10, try to get as much sleep, stay on a regular schedule, eat every 3 hours, and keep stress out of my life.
So there's a life after Lyme.
There is, and I'm really happy to help as many people and support as possible, and I spend 90% of my time supporting people with Lyme disease.
Yeah, and thank you so much for being here.
you.
I think another thing, a really important thing that you mentioned was the support for spouses of Lyme, Lymies.
Yes, and there's the Vermont Lyme Support Network and the Vermont Lyme Network that we meet once a month here in Burlington. Most of the towns throughout Vermont have a Lyme support network.
Thank you so much,
Thank you,
Sallie,
Morella.
for sharing all of your wisdom
you.
with us. And thank you for tuning in, for calling, and we hope to see you next week again with another wonderful guest.